Podcasting from St. Louis, Missouri, this is Functional Wellness with Dr. Allison, your information and inspiration hub for all things health, wellness, and functional medicine. Your host, Dr. Alison DiBarto Goggin, has been practicing functional medicine for over 11 years. She is passionate about finding root causes and solutions for gut health, hormone balance, anxiety, and autoimmune conditions. Welcome to the show. Hello and welcome. I'm so glad you're here. Today we are talking about melatonin. So are you wondering if you need to be taking melatonin to help you sleep, if there's other good reasons to take it, how much you should be taking, and how do you know if you really need it? Then this is the video for you. Welcome, I am Dr. Alison DiBarto Goggin, and if we haven't met yet, I am a functional medicine physician and a doTERRA wellness advocate. I help women overcome stress, anxiety, weight gain, and autoimmune conditions so they can feel like themselves again. So what is melatonin? It is a hormone that our brain produces to help us go to sleep, and it has a lot of other functions in the body. In my experience, I've had some success with my patients taking melatonin as a sleep aid, and others don't have as much success, and we're going to talk about why. Melatonin requires a lot of cofactors to be able to be created, and I'll pop up a graphic so you can see this exactly. But we make serotonin first, and then that converts into melatonin. And to make serotonin, we need things like iron and zinc and 5-HTP and B vitamins and methyl groups. So there's a lot of things that go into making these hormones for our body. So just taking melatonin won't necessarily help you sleep because you might be missing something else going on in your body. You also need healthy blood sugar levels and healthy insulin releases, so that way all of these cofactors can cross your blood-brain barrier into your brain, and then your brain will make that serotonin and melatonin for you. So if your blood sugar is off, or you have insulin issues, or you have a leaky blood-brain barrier, you might also have issues making neurotransmitters, going to sleep, feeling good, help with your mood, all of these things. And this is why I love functional medicine, because you might come to me with insomnia and say, I just need melatonin, or I can't sleep, I don't know what's going on. And then we get to do things like run your lab work and see if anemia is the issue, or if your blood sugar is an issue. What about your liver and your adrenals or your thyroid? All of these things can be impacting your sleep, which is why I don't like to have protocols for my patients, because while one person might respond really well to melatonin, another person might be struggling with anemia, and we need to correct those things first before you just start taking a bunch of supplements. Melatonin is created and really triggered by a decrease in light. So the number one most important thing for sleep health, of course, is your sleep hygiene. Turning off or turning down the lights at night, not using overhead lights, but focusing on lamps or lower level lights like Himalayan salt lamps. Those are a great idea as well, because that overhead light indicates to your brain that the sun is up. My other favorite thing to do is to go for a walk after dinner or as the sun is setting, because your brain and your eyes will physically see the sun going down, the light decreasing, and that will trigger your brain to start creating more melatonin so you can sleep at night. Of course, you want to use blue light filters on your phone and your devices and turn them off at least an hour before you go to bed. So again, your brain is getting that signal to start winding down and creating more melatonin. And this is also why dosing can be very difficult with melatonin, because it increases at night and then it goes down throughout the night. So when you wake up, your cortisol is high and your melatonin is low. So doing these sleep hygiene things first is going to support your melatonin production more than just taking it as a supplement. So if you're struggling with taking it as a supplement, either the dosing isn't working for you or the brand might not be working for you, you want to look for a supplement brand that has multiple cofactors in it. And I'll drop my supplement website in there so you can see the brands that I use. You can order with a discount, all of that good stuff. But you want to look for a supplement that has not just melatonin in it, but also zinc, magnesium, B vitamins, methyl groups, 5-HTP, SAMe, all of these things that create healthy levels of melatonin so you don't become dependent on it. Now, melatonin is an incredibly important hormone for our entire body, because not only does it help regulate sleep, but it also supports the immune system. It supports healing and recovery while we're sleeping. It also has amazing antioxidant benefits, and it has been shown to be a fantastic adjunctive treatment with chemotherapy for cancer patients. So, should you be taking melatonin as a daily supplement for your health? I would say probably not. It's not going to be doing that much for you, and it might disrupt your sleep patterns than be more supportive. So, unless you're going through something really specific where your physician or myself is saying, okay, I think melatonin at a low dose throughout the day might be supportive for you or at night to help with your sleep, I wouldn't recommend taking it as a daily supplement. My warning with melatonin is that you may have some side effects from it. So, my son, when he was very young, about 3, we had him on a very, very small dose, but he started sleepwalking all of the time. And I've had quite a few patients say they sleepwalk or they have trouble staying asleep. They might not recover as much because they're not getting into that deeper sleep that their body needs. So if you find that you're having side effects from the melatonin, lower the dose or stop it completely. I have not had anyone become dependent upon melatonin. There's a big debate right now, and the research seems to be pretty unclear of if you're taking melatonin every day, does your brain stop making it because it's getting it externally, and then you become dependent on the melatonin to be able to create it? Nobody's been able to give a good answer on this. I have not seen people become dependent, physiologically dependent on melatonin if they're taking it as a supplement and then they stop. Most people can stop taking it and their brain will continue to produce it and they'll be able to fall asleep on their own. Some people will have a more psychological need to take the melatonin or take something at night to help them sleep. My son now will take one of my melatonin chewables and he'll pass right out. He'll put it in his mouth, chew it, and then lay down and go to sleep. He's like, this is what's helping me fall asleep. In my head, I know that it's not at all. Melatonin is not a quick fix. It does not go to work in 20 seconds or less and knock you out. It's not that type of pill or supplement or hormone. So for him, that is a mental thing where he feels like, all right, I'm doing something to put myself to sleep and now I'm going to fall asleep, which is wonderful because he's sleeping through the night. He is happy. So I'm not going to complain. And he's no longer sleepwalking with it because we use a different company now. We use, like I said, it was a chewable. It has more of those cofactors. So sometimes if you're having an issue, it might be the company, it might be fillers, it might be something in that brand that's affecting your body. So switching brands can often be a great strategy if you're having any side effects from a supplement. And very last, for sleep support, many people need to have a sleep study done to check if they have sleep apnea or any other breathing issues going on. I would say 9 out of 10 of my patients that have a prescription for a CPAP or other breathing apparatus to help them sleep and improve their oxygenation while they're sleeping do not use their machines. And it is a major factor because if you're not getting enough oxygen into your body, you're going to be tired. You're going to have brain fog. Your body's not going to recover and work. Your immune system's going to be sad. So make sure that you get the testing done and you use the equipment that has been prescribed to you because you'll feel so much better. I know it's not sexy. I know it doesn't feel great. I know it's uncomfortable and clunky, but your health is so important that a supplement will not override the need for oxygen. So please use your machines, use what you've been prescribed because it's going to help you so much. And then you can work on all of those other underlying issues. So thank you so much for tuning in today. As always, I offer a free health consultation and health assessment so we can get to know each other, talk about your symptoms, your concerns, your goals, and brainstorm on a plan for you to move forward. Make sure you like and subscribe to this podcast and stay tuned for all of our weekly videos, and we'll see you next time. Thank you for listening to Functional Wellness with Dr. Alison. If you would like personalized care and testing, you can schedule a free introductory consult with Dr. Alison online at Little Black Bag Medicine or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and we'll see you next week.